Now on KGW News, you've heard the protests, but how do Oregonians really feel about the state's stay-at-home orders? Plus, 2 cats become the first pets in the U.S. with confirmed cases of coronavirus. And now that's changing the recommendations for pet owners. And later, a local nurse caring for coronavirus patients is getting some unique support from her neighbors.
This is KGW News at 11.
Thank you for joining us tonight. I'm Laurel Porter. We continue our coverage of the coronavirus pandemic with the goal of bringing you the facts and not spread fear. We've talked a lot about protecting our frontline workers during this crisis. Those in healthcare, obviously, but also those working in essential businesses like grocery stores. Today we learned one of those workers at a Portland Whole Foods died from COVID-19. Our Mike Benner shows us what that store and others are doing to protect employees.
At Whole Foods Market in the Pearl District, hearts are heavy following the death of a worker. The store confirms the employee died from the coronavirus.
Truly, my heart is with the family who's lost somebody that was massively important to them.
Dan Clay is the president of United Food and Commercial Workers Local 555. To be clear, the union does not represent Whole Foods employees, but Clay will tell you they are still part of the greater grocery workers family, and his heart aches for the worker who died.
That person, just like my members, go out and are putting their lives on the line, and to have them pay the ultimate price for that is tragic.
Making matters even worse, KGW has learned that a second Whole Foods employee has tested positive for COVID-19, this time at the Hollywood store. Whole Foods is not releasing any information about their roles at the stores. They join a growing list of grocery workers who have fallen ill with the coronavirus. We know of an employee at the Fred Meyer on Northeast Gleason and 3 workers at 2 Winco stores in Oregon.
Anytime you end up putting 25, 30,000 people face to face with an unseeable virus, you're going to see those cases popping up more and more and more.
Clay says a number of grocery stores have added safety measures like plexiglass at cashier stands and social distancing, but he says it's not enough. He's relieved to know the Oregon Health Authority is now suggesting grocery workers should have access to testing.
It just seems like such an obvious thing to do in my mind. They're taking the extra risk. They should know.
And perhaps it's never been clearer than right now, following the death of an employee at the Whole Foods in the Pearl.
It's got to be just a terrible time, and I feel pretty bad about it.
A spokesperson for Whole Foods Market says that the safety of employees and customers is a top priority. They say to help stop the spread of COVID-19, they're requiring temperature checks and face masks for all employees. They've improved their cleaning and disinfection procedures. They're also closing stores up to 2 hours early every night to give employees the chance to restock shelves and rest ahead of the next day. I'm Mike Benner for KGW News.
Some southern states have announced plans to reopen, despite concerns they're not taking steps to stop the virus from spreading. South Carolina reopened some businesses today. Georgia plans to do the same Friday. Many states are seeing protests demanding stay-home orders be lifted. But that's despite overwhelming support to keep them in place. A new Associated Press poll found only 12% of people think restrictions where they live have gone too far. And that's the situation in Oregon, too. In a survey of Oregonians from DHM Research, 82% of people said they supported stay-at-home orders, while only 16% opposed. By political party, 96% of Oregon Democrats support the orders. 72% of Republicans also showed support. The survey was done between April 17th and the 21st. Meantime, California is taking a small step toward reopening. Hospitals are resuming scheduled surgeries. That includes surgeries that are not emergencies. California's governor says this is the first significant change to the state's stay-at-home order that's been in effect for more than a month. Hospitals in Oregon are anxiously waiting a return to normal, particularly in rural areas. They have been hammered by the recent lack of business. But as Pat Doris reports, there is reason for some optimism today.
In small towns around Oregon, hospitals are often the biggest employer. But in the upside-down world of COVID-19, Hospitals here are one of the businesses hit hard financially. That's because the state ordered an end to all elective surgeries to save protective gear, and at the same time, hospitals prepared for a large number of COVID-19 patients who have not arrived. That left many with little or no business and took them off a financial cliff.
At the end of February, we had 28 days cash on hand. So it has forced us to take some dramatic expense reductions.
Ginny Williams is the CEO of the Curry Health Network in Gold Beach. She's had to lay off staff and lost some doctors when she tried to renegotiate their contracts.
We just can't afford to have people here and not seeing patients and not working, not generating revenue. It is how healthcare is established in our country, and it's unfortunate. It's hit us hard.
This morning, the hospital got a $4.5 million payroll protection loan from the federal government. Still, the damage is done. It's heard in Lakeview as well, where Charlie Tweet is CEO.
Could you talk about how COVID-19 has impacted you folks financially?
Oh, it's been a mess, to say the least. We are one of the few counties that have no patients.
He said his hospital lost about $3.5 million from canceling all elective surgeries. He also received federal money yesterday, but worries about how long it will last with the shutdown. It's a similar situation in Eastern Oregon, where Ken Hart is CEO of the St. Alphonsus Hospital.
Our volumes are down across the board in the hospital with the announcement to suspend elective surgeries here. Our volume in that area is down 70%. Our ER volume is down as well. So the financial impact of not having those additional procedures happen in the hospital has been fairly severe.
Governor Kate Brown recently said she wants to get rural hospitals back operating.
These hospitals are just really, really challenged. They have very few beds, and they provide what I would consider critical care to Oregonians living in these communities. So I think it's so important, both from a healthcare perspective, but frankly, also from an economic perspective, to get these hospitals and the healthcare providers open as quickly as possible.
The governor is meeting with her health advisory committee to decide when that should happen. The executives I talked with today said they are ready right now.
We would very much appreciate that ability, especially in the rural areas like ours that have had a very, very limited impact as far as positive COVID.
That was Pat Doris reporting. Oregon has now designated 2 emergency centers to try to stop virus outbreaks at long-term care facilities. This is one at the Pacific Health and Rehabilitation Nursing Facility. This is in Tigard, and they started accepting patients today. The other one is at Laurelhurst Village Rehab in Portland. Both of those locations will look after COVID-19 patients who live at long-term care facilities. Several of these homes in Oregon have had COVID-19 outbreaks and multiple deaths. Let's talk about our pets for a minute. Can they get coronavirus or can't they? This is something we know we've been hearing conflicting information about. Now 2 cats in New York have tested positive for the virus. They are the first cases of pets in the U.S. getting infected. The cats have had mild symptoms and they are expected to recover. It's believed they got infected by people in their homes or neighborhoods. While we can spread, it seems, the virus to our pets, there is no evidence, at least right now, that they can give it to us. Still, the CDC is now recommending that people prevent their pets from interacting with people or animals outside their homes. You're also asked not to touch your pet if you have the virus and wear a mask while caring for them if you have tested positive. Because of this pandemic, Oregon's tourism industry has come to a standstill. Most hotels are empty or close to it, and conventions have been canceled. It could be months, maybe years before tourists return for big events.
There's a very kind of a long timetable here, and it's going to be accentuated by the fact that mass events will be sort of the last thing that come back to normal.
Portland predicts revenue from lodging taxes will be cut in half over the next year. That'll result in a $20 million shortfall. Cities on the coast will be hit particularly hard. Some do have extra money saved to stay afloat for now, but could be in trouble if the sharp drop in tourism stretches into next summer. With record unemployment, our KGW Q&A webcast tomorrow focuses on who is hiring. Host Galen Etlin will take your questions as he talks with experts who help businesses find employees. Whether it's temp work or a long-term position, they'll cover where and how to look for a job. This starts at noon tomorrow. You can watch it at kgw.com or any of our social media platforms. Coming up on this Earth Day, we'll verify just what impact the coronavirus shutdown is having on the environment. Plus, a battle cry for a warrior. A couple of local teenagers helped cheer up their friend and neighbor who's fighting the virus on the front lines.
And I'm Matt Safino. Hope you had a good Earth Day. We'll take a look at the temperatures in Portland from our very first Earth Day 50 years ago until today. Talk about the rain that we had, the rain that's on the way, and you remember those Starlink satellites? I've got video.